Good evening all. Today our class is about deltoid muscle. Today our class is about deltoid muscle. Listen the video audio completely and watch the video completely. Then go through the notes available in Instagram. Then you can remember it for long time. Today our class is about deltoid muscle. It is very important for 5 marks question. It is important for 5 marks question as well as in the Viva section. And I already told in the last class, while studying about the muscles, we should know about the origin of the muscle, insertion of the muscle, nerve supply of the muscle, then action of the muscle, action or function of that muscle, action or function of that muscle. Okay. Now coming to the point, the origin, where the deltoid muscle, the origin takes place at. See, at the deltoid muscle, the origin takes place at the anterior border of lateral one-third. See, this is the scapula. This is scapula. I'm sorry. This is clavicle. I will write here. This is clavicle. And this is scapula. Clavicle and scapula. At the lateral one-third of the clavicle, that means here is the lateral end of the clavicle and it is the medial end of the medial two-third of the clavicle. And here lateral one-third of the clavicle, the origin of deltoid muscle takes place at lateral one-third of the clavicle on anterior surface. Okay, that means here is the anterior surface. This is the anterior surface of the clavicle and this is the first origin. The next origin takes place at lateral border of acromion process. That means here, this is the acromion process of scapula and this is medial border and it is the lateral border. So, it comes from the origin. The origin takes place from the clavicle to the lateral border. That means here, lateral border of acromion process. That it is the second insertion. And the third one is lower lip of crest of spine and it is the spine of scapula. Here is the upper lip and it is the lower lip. So it comes from the lower lip of crest of spine, and here the muscle attaches like this. The origin of the muscle takes place from the lateral side of acromion process and lateral side of clavicle and lower lip of spine of scapula, and here is the origin. There are 3 parts of origin takes place. This is all about origin. And now it comes to the insertion. The insertion, all the 3 origins inserts at only one place, that is, if it is the humerus, I will draw here clearly. It is the humerus and it is the anatomical neck and it is the head of the humerus, and the origin, the insertion takes place at the point here at the humerus, where humerus contains deltoid ridge here. Okay, humerus contains deltoid tuberosity. This is the deltoid tuberosity. These 3 origins inserts at the deltoid tuberosity of humerus. Okay, so the origin takes place at clavicle, scapula and spine of the scapula, and the insertion takes place at the deltoid tuberosity of humerus. This is all about insertion. Now comes to the nerve supply, axillary nerve. Axillary nerve. We will study about axillary nerve later. Axillary nerve C5 and C6. That means cervical, 5th cervical and 6th cervical. C5 and C6. This is all about nerve supply. And then comes to the action of that muscle. It is multipinnate muscle. That means many fibers attach comes from this muscle, so it is called multipinnate muscle. So this muscle helps in the powerful abductor of the arm at shoulder joint. That means powerfully abducting the shoulder. That is the first action. And the second action, its anterior fiber helps in the flexion and medial rotation of arm, and its posterior fiber helps in the extension and a lateral rotation of arm. Okay, there are 3 functions or actions. First one is it helps in the powerful abduction of arm. Next one is its anterior fibers helps in the flexion and medial rotation of arm. Next one is its Posterior fiber helps in the extension and lateral rotation of arm. This is all about the action of arm. We have completed origin, insertion, nerve supply and action or function of the arm. This is all about the deltoid muscle, important for 5 marks question. And from tomorrow we will start the pectoral region. That means tomorrow our class is about breast. Very important for 15 marks as well as 5 marks as well as 2 marks. Thank you all.